Good evening, everyone. My name is Dr. Kurt Woeller. I appreciate you joining me tonight for this webinar on a topic with respects to multiple sclerosis and complementary medicine. I've been doing these webinars now through Great Plains Laboratory for a good 4 years or so, primarily talking about functional medicine, what we call biomedical intervention for autism and other health disorders, and now starting to expand that knowledge into the realm of multiple sclerosis with the understanding of how complementary medicine, nutrition, supplementation, etc. Can help many individuals suffering with this disorder. And I'll be planning on doing these webinars now on a monthly basis, bringing this information to you. I hope you find it useful. This is the first in a series of webinars to come, and I think you'll find this information helpful and educational. Before I get started, I have been involved in patient education for many, many years in the patients I've worked with from within the United States and abroad. One of the big things that I'm very much into is helping people become educated about their health condition. It's imperative that you as an individual become intimately involved in your health care, and that requires also becoming educated about what are the different treatments, particularly when we're talking about dietary intervention, supplements, some of the biochemistry. I don't expect my patients to become biochemists. Certainly don't expect them to be physicians and understand everything, but having a good working knowledge will help you become a better consumer, for one, and also help you to better understand what it is you're dealing with and how to make an informed choice into what's being offered for you. So that's one of the things that I've done with many of the patients I've worked with. And in doing so, we recently released a membership website. This is a subscription website for people with multiple sclerosis or friends or family members of a loved one with MS who wants to have direct access to a physician. This website is called AskTheDoctor-MS.com, and this is where I answer questions with respects to complementary medical therapy, diagnostics, etc., with specific topics to multiple sclerosis. And we have a very active member where you as an individual can pose questions on a daily basis. I answer those questions on a daily basis. We also have access to other health professional information and supplements, resource information, videos, articles, etc. So if you want to learn more about that, you can go to AskTheDoctor-MS.com. Also, I have an official website called drwoeller.com, www.drwoeller.com, and here is this sort of the hub of the wheel of what I've created over the years with respect to information I have on the internet, from books to videos that we have on YouTube, Vimeo, etc., where I'm speaking, things that I've been involved in, newsletters, etc. So you can go to drwoeller.com, learn more about me, sign up with your name and email address to receive information that comes from this website and others that I've created. So tonight, I want to introduce the concept of complementary medicine and various therapeutic options that I feel you as an individual should absolutely know with respect to multiple sclerosis. So I'm going to talk a little bit briefly about MS, statistics and symptoms. We're going to define what is complementary medicine and called integrative medicine. And then I'm going to go through a few examples of some complementary therapy that has been very beneficial for people in my practice, and I know others within the MS community. We're going to talk a little bit about dietary intervention. I'm going to introduce a concept called chronic stress response and how that ties into adrenal, thyroid, immune, and detoxification problems. We'll talk a little bit about low-dose naltrexone, and then finish up with a therapy called Prokarin therapy that I want to introduce a concept, if you haven't heard about it, in how you can view MS not necessarily as an autoimmune disorder, but there's a theory that with respect to MS actually being a biochemical imbalance in the body. So, excuse me. We know that MS is a neurological disorder having quite devastating effects. It affects upwards of 3 million people in the U.S., more than 6 million people worldwide, and those numbers are growing. There's approximately 200 new cases of MS diagnosed each week. Currently, the ratio of female to male with respect to MS diagnosis is about 3 to 2, and now we're starting to see MS showing up in elderly individuals as well as children. The disease has always been complex, been very difficult, particularly in the early stages, to define. And so it's been a difficult thing for many people to actually get an official diagnosis, at least early on. There is one specific symptom that many individuals with MS have that actually makes it, this particular symptom, if you will, is very specific for people with MS, and that is heat intolerance. And this is not just being uncomfortable in the heat. Certainly when it gets too hot, any of us can be uncomfortable or tired. But this is extreme weakness, extreme fatigue that comes about from being exposed to heat. And we certainly know that fatigue is a classic symptom, or one of those, with respect to multiple sclerosis. The overall clinical picture of MS as things progress, can include numbness and tingling, progression and loss of sensation, certainly movement dysfunctions from weakness, spasms, and paralysis, visual problems, whether it's blindness, double vision, etc. And then certainly a lot of individuals have cognitive problems, bowel issues, bladder problems, etc. So as the condition progresses or relapses, these are many of the things that will manifest. So I'm not here to talk tonight about traditional medicine, okay, medications per se, which certainly many of them can be helpful and incredibly so for some individuals, but we certainly want to introduce the concept of what is complementary medicine and how might this help you. Complementary medicine is really defined as a group of diagnostic, so testing, and therapeutic disciplines that are used often in conjunction with conventional medicine. So an example would be using a traditional medicine and acupuncture, or using an antibiotic plus an herbal remedy for yeast bacteria. I like to use the term integrative medicine. Integrative medicine to me is the concept of we're not only incorporating complementary medical options, but we're also incorporating many conventional treatments as well that are appropriate, but with the understanding that we're not necessarily defining one better than the other unless it's we have pure scientific data to indicate that's the case, but that all of these different therapies have the potential to help a broad spectrum of people in the context of everything that is going on with respect to their life. And that's not only what's going on with them physically, what's going on with them spiritually, what's going on from a mental, emotional standpoint. And so when we talk about integrative medicine, it's integrating information we know with respect to conventional therapeutics, complementary medicine, but how that fits into somebody's total picture with respect to their daily life. And that certainly is going to include lifestyle factors as well. So Dr. Andrew Weil is a very well-known MD who has used this term with respect to integrative medicine, and not only in his writing and his teaching, talks about it just as that. It's the emphasis on the therapeutic relationships between these different modalities that is encompassing the whole person. Now, a couple principles with respect to integrative medicine, and this is important, is that the principle of integrative medicine, including complementary therapies, is a philosophy that it doesn't reject conventional medicine, nor does it wholeheartedly accept alternative therapies without critical analysis. And I think that's important because there's a lot of things that are thrown around, whether it's supplements or herbal remedies or whatnot, that are heralded as being these greatest end-all be-all treatments, and oftentimes they're not studied, they're not researched, and many times some of them, not all of them, don't necessarily do what we're hoping they might do. So the principle of integrative medicine is that the recognition is that good medicine should really be based in good science, be inquiry-driven, and that this system of medicine and a physician such as myself should be opened to new paradigms, new ways of thinking, because clearly, I've been doing biomedical intervention, integrative medicine, this sort of complementary approach for many, many years, but I don't know everything, and I learn just as much as a physician from my colleagues as I do my patients. And many times patients come to me with things that they've learned about that they would like to try, and we implement them, and if they work, then that's another thing that I can add to my tool bag as a practitioner to bring to another patient. My goal as a doctor is to work with individuals and helping to bring to them the education that they need to become healthy, but also bring to them a wide variety of therapy that can help them get better. And ultimately, to try and use as many things that are natural, not toxic, or at least with the reduced side effect potential as possible. So again, some of the examples of this may be acupuncture, or homeopathy, or herbal medicine, whatever it may be. But again, it's rooted in science and critical analysis. So let me shift gears here. Let's introduce the first concept with respects to what could be considered a complementary therapeutic approach to MS. Much of my background has been involved in working with kids on the autism spectrum, but I've also worked with patients with various autoimmune disorders over the years, and just patients who just are chronically ill but don't have a defined disease. And one of the things that we have found that many, many people suffer with is gluten sensitivity. And gluten, being the protein found in wheat, is quite prevalent in people who have any type of inflammatory condition, whether that's a joint inflammatory issue, a digestive inflammatory problem, or a neurological inflammatory issue. Now, we don't necessarily have to have celiac disease in order to indicate the need to go on a gluten-free diet. And many times just showing evidence of gluten sensitivity is enough. This is a particular study that came out of Israel a number of years ago, where they took a group of individuals and studied, their markers with respects to gluten antibodies. This is where the immune system is actually reacting adversely to gluten proteins, and how it cross-reacted with tissue in the body, specific with respects to multiple sclerosis. And what they found was that even though the pathogenesis of multiple sclerosis remains somewhat unclear, what the authors found was that individuals who actually implemented a gluten-free diet were improved with respect to their overall symptomatology. Another study out of Spain showed that there was a direct link between multiple sclerosis and celiac disease. Now, these were individuals who were diagnosed with true celiac disease, which is an advanced version of just ordinary gluten sensitivity. And what they did is they took a group of 72 individuals with diagnosed MS. They took 126 individuals, the first-degree relative of those people with MS, and then 123 healthy controls. And what they found through diagnostic analysis, this is where they did celiac blood tests as well as bowel biopsies, that approximately 11% of people with MS compared to 2.6% in control individuals had diagnostic criteria for celiac disease, quite a significant increase in the MS population. And what was interesting is that in the relatives, the first-degree relatives of those with MS showed 32% of them showed evidence of celiac disease. And so what they found is that when these individuals went on a gluten-free diet, Overall, they felt better, they felt stronger, there was less intestinal problems, and they improved. So what I want to impress upon you is that there's not one treatment for MS. Just as there's not one pharmaceutical drug for MS, there's not one complementary treatment. It's not just all about diet or all about a group of supplements. Many of these therapies work collectively, and in some people they work exponentially. You add one and you get a greater percentage as you add more. So it's really about finding out the puzzle, if you will, with respect to what's going to work for a particular individual's multiple sclerosis. I've used this puzzle analogy now for many years with respects to the autistic kids. We're oftentimes trying to find out, well, how big is this child's particular autism puzzle? Are we dealing with a child whose puzzle is 6 pieces, which is sort of mild, or are we dealing with a child whose puzzle is 600 pieces, which is very complex? The same thing can be applied to really any patient population, including MS. So what is it about your particular MS puzzle that's unique to you? The problem is that traditional medicine is limited in the tools that it has to really look at somebody's underlying medical condition from a functional standpoint. They might do a blood test and find out that, okay, and so you're essentially diagnosed with MS based on symptomatology, MRI scans, whatever it may be. But they don't have the ability or even recognize that you can dive deeper into somebody's biochemistry and somebody's physiology, looking at thyroid, looking at adrenal, looking at digestive problems, nutritional issues, food sensitivity problems, all of these things that can have an adverse effect on our underlying physiology and biochemistry, and certainly with respects to MS, our nervous system. So that's really the main difference between a functional medicine or a biomedical approach as opposed to a traditional medical approach. Now, just to go a little bit further with respect to this concept of diet, there's a very interesting diet called the Best Bet diet, which was established by an individual called Ashton Embry, who's the president and research director of a Canadian-based MS information site at direct-ms.org. And the idea here is to try to eliminate foods that are thought to have a high potential to stimulate immune reactions to myelin, essentially what we call cross-reactivity. And that is, we know that in celiac disease, the gluten protein can many times cause an immune reaction that not only is occurring in the gut, but then that cross-reaction to that gluten protein has a similar appearance to various protein structures in the brain. Matter of fact, there is a percentage of people with celiac disease who don't really have digestive issues that are recognizable, but they have balance problems or cognitive problems or joint pain or other issues in the body that don't appear to be related to anything going on in the gut. And why that's happening is they're getting a cross-reactivity, a molecular mimicry immune reaction from a food protein to another protein in the body. So the Best Bet diet, and there's many different types of elimination diet, but the Best Bet diet is fairly popular within the MS community, where we're avoiding a wide variety of what we consider to be pro-inflammatory, highly reactive foods. Dairy, gluten, legumes, beans and peas, peanuts, soybeans, refined sugar, just because the refined sugar tends to be a stressor and in certain individuals causes inflammation. Some individuals are sensitive to eggs, yeast products, etc. And so if you think about immune sensitivity to food, essentially what we're trying to do is eliminate those things that could be triggering an adverse immune reaction that are known in science to have a potential for cross-reactivity to various body tissue, including the brain, and that tend to have an overall draining effect on the immune system to where we're just in more of an inflamed state. Now, what I often do with patients is I do something called a food sensitivity profile. This is looking at IgG reactivity, which IgG is an immune chemical that our body makes as a long-term memory marker to some type of adverse immune event, particularly when you're looking at it with respect to food. This is different than IgE, which is a true chemical with respect to allergy. But many people who have adverse food reactions, it's IgG mediated, and IgG is known to also trigger inflammatory reactions in the body. And so this becomes an important test when we're trying to analyze just for somebody's system that is overburdened by a lot of food sensitivity, and that those reactions can occur in the gut, they can occur systemically throughout the body, and certainly we know they can occur neurologically. The main lab that I've used for years in this type of testing is Great Plains Laboratory. Great Plains is in the Midwest. They are well established within the industry with respect to high quality testing. They have accounts all over the world that they distribute their testing from, and they are leaders in food sensitivity testing, as well as what's called organic acid testing or metabolic testing for underlying issues within the body. They do a very good job too with respect to heavy metal toxicity. So let me shift gears again, okay? But we're still keeping on this theme of immune reactivity and inflammation. We know that in MS, the brain and nervous system are the primary areas of involvement. And we know that there is an inflammatory component to this disorder. We know that the blood-brain barrier is one area that is often faulty in anybody with neurological inflammation. We see it in autism, we also see it in MS, and other types of neurological disorders. The blood-brain barrier essentially is that barrier that protects the brain and allows the good stuff in and tries to keep the bad stuff out. You can think of it analogous to the mucosal barrier within the gut. We've all heard about leaky gut, and this is where the gut wall starts to break down and we get food proteins and bacteria and other pathogens that can find entryway into the bloodstream because that mucosal barrier has been damaged. Well, the same type of thing can happen in the brain where the blood-brain barrier essentially breaks down and, if you will, becomes a bit leaky. So we start to get things moving into the central nervous system that shouldn't be there. The problem is when we get infiltration across the blood-brain barrier into the brain itself, we start to trigger various cells in the brain that can then further inflammation. One particular cell that is problematic long-term when it becomes chronically activated is something called microglia. Now, there's a lot of research going on now as far as just general neurological inflammatory problems with respects to microglia, not only in autism, but you also can find this information with respects to multiple sclerosis too. Microglia are the main immune defense in the brain. About 20% of all of the what are called glial cells in the brain are made up of microglia. They're essentially constantly on the prowl looking for invading pathogens. And when they find something, they will initiate an inflammatory response to try to bring other aspects of the immune system into that area to try to neutralize the problem. The problem is that microglia can tend to become chronically turned on. They become activated and they never turn off. Or they may pulse on and off, but for prolonged periods of time. And when you have that type of situation, you not only can lead to inflammatory reactions that damage cells, but you can also lead to cellular death. And so we run into a cyclical problem, what we call microglia activation, where as the cells die, it releases chemicals that then damage adjacent cells. Those adjacent cells become damaged, which elicits more microglia activation to try to come in and clean it up, more inflammation, et cetera, et cetera, et cetera. We see that certain individuals are susceptible to microglia activation from exogenous exposure. So chemicals in the environment can be a trigger for that. We certainly know that certain individuals react negatively to vaccines. Vaccines have been known to trigger microglia activation. Heavy metal toxicity as well. But we're also exposed to endogenous toxins that can trigger these things as well. Metabolic toxins from a breakdown of an organ system, or a bacteria or a virus could also trigger these as well. The bottom line here is that microglia activation can also be triggered because of adverse food reactions. Gluten, other food sensitivities can be a contributing factor to inflammatory reactions in the brain. So that's why in my work as a physician for years is why diet is so important. And diet is not just about losing weight or having better complexion, which certainly those are important. But from a dietary intervention standpoint specific to MS, it becomes critical because we're trying to downregulate overactive immune system that is driving inflammation. All right, I'm going to introduce something here called chronic stress response, or what we call the stress-induced hormonal imbalance. And while I'm doing this, I want you to think about how stress can be manifested in many different ways. Okay, we know that the definition of stress is that it's a force that tends to strain or deform, AA or deform. It can be physical. It could be a traumatic injury, a broken limb. It can be chemical. Okay, environmental exposure. It can be emotional, so our mental emotional state. And what it does is it causes the body and the mental aspects of our body to be tense, to shift in its ability to compensate, and over time can lead to disease manifestations. And so again, there can be a whole host of things that cause stress, from physical injuries to mental emotional factors to chemical to toxic foods to vaccines to heavy metals. Just life stress can lead to chemical shifts in the body that can be damaging. What I have found over the years is that the number one thing that tends to cause the main problem with stress in our life is things that tend to shift our mental emotional stability. It's how we perceive an event rather than the event itself. This is the most important thing with respect to generating a stress response. The second most important thing that is involved in the chronic stress response is diet. So I talked before about inflammatory foods. That's certainly important, but it's poor blood sugar control. That is also critically important too. Eating too many carbohydrates, and this causing a rapid elevation up and down of blood sugar. And this dysregulation that occurs with respect to insulin, and then what we're going to talk about with respect to cortisol. So the improper balance of blood sugar and eating the right foods causes a tremendous amount of stress on our body physiologically. And then sort of the third category is what I call everything else. Okay, it can be everything else. It can be infections, it can be physical trauma, it can be temperature regulation problems, you name it. Everything sort of else gets thrown into that last category. So what these slides are going to show you is how the brain interacts with the adrenals, the adrenal glands being a regulatory gland that regulates hormone production, and how a dysfunction in that can lead to the inability to control inflammation. Things that are called inducers of ACTH, adrenal corticotropin hormone, is the hormone that comes from the brain that tells the adrenal glands to make more cortisol. Anytime we have tissue damage, whether that's inflammation from a food, an infection, an injury, is going to tell the brain to release more ACTH. Glycemic dysregulation is a fancy word for poor blood sugar control. Again, a major problem with respects to increased ACTH production. Sympathetic overflow, essentially that's the fight or flight response, that having that accelerator on all the time in the body that's being often driven because of mental emotional stress. Certainly a person who is type A is going to have the potential for more sympathetic output and more adrenal stress through brain function. This is just a pictorial, slide, a few slides here, just to kind of show you what we're talking about, from with respect to overall stress. And some of these slides have actually been from conferences where I've talked to physicians, just trying to help them even understand, how stress can be accumulative. So in this particular individual, they start their day nice and happy, and then, we walk out of our homes or even our own homes, we can be exposed to environmental toxins. So environmental toxins, smog, bad air, chemicals can be a toxic stress. Fear. I think today more than ever, because of the movies, the TV, videos, we're exposed to these types of things much more than we used to be, certainly with the 24-hour news cycles going on. So fear has a tremendous impact as far as our mental, emotional stress. And then the drugs, whether it's prescription drugs, whether it's over-the-counter, whether it's self-induced drugs from alcohol, whatever it may be, this has a cumulative effect as well. Certainly toxic foods. Many people who are under stress will tend to gravitate more towards carbohydrates. It's that quick energy, they feel good eating it, and they eat more of it, more of it, more of it, and it tends to cause problems. And plus all the chemicals in food, etc. And then of course just the accumulation of mental emotional stress is problematic. The bottom line here is that all of this, okay, piles together to cause what we call a hormone immune metabolic breakdown. All of these things will drive this ACTH increase to drive our adrenals into suppression. This is a very complicated, very sort of heavily loaded slide. But I want to walk through a few things here. If you look on the left where it says potential sources of stress, okay, we've kind of gone over all of these, all right? So as I mentioned before, mental emotional tends to be the number one for most people, and then poor blood sugar control. So we have the stressor. What normally should happen is we have a stressful event. We have an outflow from the sympathetic nervous system that tells the hypothalamus to produce ACTH. And ACTH then flows down to tell the adrenal glands, or what's the adrenal cortex, to produce cortisol. Cortisol is produced at a certain rate. It controls all regulatory function throughout the body, inflammation, immune function, etc. The situation is resolved, and our cortisol levels go back to normal. The problem with chronic accumulative stress is that this sympathetic output never turns off. So the input into the brain never turns off, and the output of ACTH is just increasing ever more over and over and over. And it's just constantly signaling to the adrenal glands, make more cortisol, make more cortisol, make more cortisol. Well, over time, what happens is that our adrenals become fatigued, and our ability to output cortisol becomes compromised, and people run into an adrenal insufficiency issue. The problem with that is that the other dependent hormones on that pathway and the other systems in the body that are dependent upon a normal functioning cortisol system become compromised. If we come down here under these three brackets, we can see that energy production becomes compromised as our cortisol levels become dysregulated in response to something called DHEA. DHEA is another hormone in the body that's linked to estrogen and progesterone balance, but it's also very important with respect to the immune system and keeping our body in tune. So we run into a problem of gluten production, insulin sensitivity, glucose utilization, poor blood sugar control, etc. We can have problems with the bone loss. We can start to lose bone, we start to accumulate fat, we start to break down our own body tissue, our body protein. We have salt water retention issues leading to high blood pressure. And then finally here on the far right would be things that we could think about with respect to something like multiple sclerosis. We start to downregulate something called secretory IgA. Secretory IgA is a critical chemical in our gut. It's what helps with our mucosal immune system, our first line immune defense in our digestive tract. You downregulate secretory IgA, essentially you run into a leaky gut situation. You have the inability to control pathogens in the gut. Bacteria, yeast become problematic. We have something called antigen penetration. Antigen is anything that will elicit an immune response, essentially. Okay, so we have increased absorption of toxins, increased circulating immune chemicals that are driving inflammation. And then finally, you can see down here under clinical conditions is a whole host of disorders that can manifest because of a chronic stress response. I've seen over the years that many individuals are triggered into MS, or however you want to phrase it, because of a stressful event. Not always, but oftentimes, and my patients have told me that there was some type of stressful event. It could have been a death in the family, it could have been a long period of stress that they were undergoing at their job, an injury of some sort, a long-standing infection, and then many people with respects to MS having exacerbations or relapses can many times be triggered because of some type of stressful event. This chart here describes what I'm talking about with respect to these hormone pathways. Up on top, we have cholesterol. Cholesterol flows down to become something called pregnenolone. Pregnenolone is a master switch hormone, if you will. It will go into a variety of different directions. It can flow down into DHEA, DHEA that can convert into testosterone or estrogen. Pregnenolone can also become progesterone, which helps to feed cortisol. It can also go to this area called aldosterone, which helps in the regulation of sodium and potassium. Now you notice this red arrow. This is called the pregnenolone steal. When our body is under chronic stress, we essentially convert a greater percentage of pregnenolone to cortisol because this becomes the preferential pathway under stress. Essentially, the body is producing or trying to produce ever more cortisol to try to regulate body function, and these other hormone pathways start to become compromised. Cortisol has a regulatory effect within the cells. We know that cortisol helps to control the function of DNA. DNA is important for transcription with respect to RNA to help make proteins in the body. So if we have a dysfunction in cortisol, we will also affect what's happening at the cellular level. We can start to have problems there. This slide really just shows you where cortisol has its functions. The normal balance between cortisol and DHEA is critical for control of immune function and inflammation, for maintaining normal hormone balance in the body, for maintaining the integrity of the brain and the nervous system. So the story gets deeper as the further we deepen. We have the ability actually to assess these systems through various functional testing. This is a slide that shows you a direct relationship between adrenal stress and thyroid. Many people have low thyroid. I see many people with MS who have low thyroid issues who are often helped by being put on thyroid medication. But many times the thyroid problem is only secondary because they've had long-standing adrenal insufficiency. That's not to say that you wouldn't do thyroid treatment, but to really get at what's going on functionally in the body, we also should be assessing the adrenal system. So one of the things that I've done in my practice for years is salivary adrenal testing. Salivary adrenal testing is great because you're getting a real-time functional analysis of adrenal function over time throughout the day. Also, saliva is looking at what's called the free fraction of that hormone, the physiological active form of that hormone. This is different than doing a blood test for cortisol, which often is not considered a functional test because usually it's only being done once a day. And many people don't like getting their blood drawn because that causes stress, and that can artificially, in some people, elevate cortisol. So adrenal salivary testing is by far the most effective way of testing your adrenal function. So as I've mentioned here, cortisol is a natural anti-inflammatory chemical. And again, the most effective way of testing or evaluating for adrenal function is through salivary adrenal testing. There's a medication called Acthar, and if you look at the letters ACTHAR, what this is an intramuscular injection which stimulates ACTH, adrenal corticotropic hormone. And it's stimulating ACTH that to actually tell the adrenal glands to produce cortisol. And this is a medication that's actually being used in MS, particularly with respect to acute exacerbations of multiple sclerosis. It's also being used in rheumatoid arthritis, as well as other dermatological and collagen diseases. So even from a traditional medical standpoint, they understand the relationship between the adrenals and cortisol production and inflammation, and how poor adrenal function can be a problem with respect to chronic MS. Now, there's I've written an article on the link between adrenal dysfunction and multiple sclerosis. There's a wonderful website which I encourage all of you to visit and become members at msrelief.com. And this is a comprehensive website that not only talks about the medical issues with respect to MS, but also talks about lifestyle factors, personal growth, insight into choices, finance. It's really an all-encompassing, very worthwhile website for anybody who is dealing with multiple sclerosis. I'm a medical contributor to that website, and there's a lot of other authors as well. What are some labs that you can think about with respect to multiple sclerosis, really sort of apart from maybe what you've already done, which is usually just some basic blood work? And I'm going to be expanding on this too as I do more of these webinars, so in further recordings. But I always like to do an organic acid test from Great Plains Laboratory. This looks at metabolic imbalances, yeast, bacterial toxicity. I like to do digestive pathogen testing to look for parasites and other bacteria. I like to do comprehensive food sensitivity as well as gluten sensitivity testing. Many times we'll do what's called a mucosal barrier test that evaluates for the immune function within the gut. Hair analysis, salivary adrenal profile, metabolic assessment, looking at protein digestion, liver detoxification. This would be an excellent workup for anybody who is dealing with multiple sclerosis to see what exactly is going on at a deeper level in your body. Let me shift gears here and introduce another therapy to you that also then plays into this issue with respects to immune dysfunction. There's a therapy called low-dose naltrexone that has been around for a long time. You can learn more about it at lowdosenaltrexone.org. And naltrexone as a medication has been around for a long time, particularly used at higher doses for individuals who are heroin or morphine addicts. And essentially what naltrexone is doing is it's blocking opiates. Dr. Bahari, doing research in New York, found that using naltrexone at a low dose, anywhere between 3 to 4.5 milligrams, given in the evening time, had a beneficial impact at modulating immune function in a wide variety of people with immune disorders. And what's happening is that there are certain opiates. These opiates are endorphin chemicals which act, if you will, like certain regulatory chemicals within the immune system. And that what Dr. Bahari found was that using low-dose naltrexone, which is essentially about 1/10 the normal dose of naltrexone used for, let's say, a heroin addict, helped to boost the immune system and fight various disease processes, including multiple sclerosis. It's been useful. It's been a fantastic therapy for individuals with rheumatoid arthritis, helpful as well for people with inflammatory bowel disease. And I've seen it also very helpful for some kids on the autism spectrum. So what's happening is that it's causing a mild suppressive effect on these endorphins at a particular time in the evening, and then there's a counter regulatory or a compensatory increase of these endorphins later on, and that's what's having this positive shifting effect, if you will, in the immune system. So it's been very safe. It's not addictive, and the side effects of it really have been quite minimal, which I'll talk to you here in a second. It comes in a capsule or a cream. Usually the cream is for kids. The dosing of it's important, at least initially, and this is one of the things you can work with your doctor on to figure out the optimal dosing. But in essence, low-dose naltrexone should be taken at night, ideally between the hours of 9 and 2 a.m. The misprint at 2 p.m. it should say 9 to 2 a.m. So the easiest way to think of it is between 9 and midnight at night. So many times I just have people take it before they go to bed. And again, as I mentioned, it can come as a cream. Now, in some individuals with MS, we need to start at a lower dose. 4.5 sometimes is too much in the beginning. So I'll start with a 1 or maybe a 1.5 milligram capsule and then work up slowly. The nice thing is it's compounded. So there are a number of compounding pharmacies around the U.S. that actually make this specially, and it's relatively inexpensive. I mean, in most cases, maybe $35, $40 a month. In my experience with people with MS, sometimes there's an initial increase in weakness or fatigue if the dose gets a little bit too high. Remember, the max dose is 4.5, and so if we find that happening, we usually stop it for a period of time, maybe 2-3 days, and then restart it at a lower dose. Everybody's going to be a little bit different, but we're not using really any more than 4.5 nightly. And the people who've responded, which is the vast majority of them, there's been improvement in energy, improvement in coordination and muscular strength, less spasms, overall, just overall improvement in their overall symptoms. Okay, so I've talked a lot about the chronic stress response, talked about food reactivity, we talked about immune dysfunction, various tests. So let's sort of wrap up here on what are some proven facts about MS, and realize I'm not going to talk about all of these things tonight, but I want to highlight for you a different way of viewing MS and a particular therapy that has shown to be helpful for many people with MS. And I'm going to really kind of pay attention to the things that I've highlighted here mostly in bold black. We know that the myelin in MS in the brain is damaged. We know that macrophages, which are immune cells that are responsible for cleaning up debris from the area of cell destruction, are often present at the site of lesions in the brain of individuals with MS. Heat, I mentioned, usually worsens the symptoms of MS, and so we know that people are very heat intolerant. Interestingly, many MS patients have low melatonin levels, melatonin being that hormone that helps with sleep. We know that the blood-brain barrier, that protective mechanism around the blood vessels in the brain, can be damaged. Multiple sclerosis patients often have impairment in histamine metabolism, and I'll discuss this briefly. Fatigue, again, makes up a huge part, quite debilitating. And that stress often triggers an exacerbation in MS and a worsening in symptoms. Okay, so these slides are from Elaine Delac. Elaine is an RN who developed a therapy that I use in the autism community called Respin-A. She also is the innovator of a therapy called Prokarin. And let's go through these slides here real quickly to kind of introduce this concept to you. Through Elaine's research, what she has found is that many people with MS, I shouldn't say many people, but in general MS, have a dysfunction in histamine metabolism. And essentially what they have is they have a problem in making histamine 2. Okay. When we make too much histamine 1 is where we start to run into a problem where people have more allergies. They have more reactivity to food, more digestive problems, more inflammation. So if we can't convert histamine into histamine 2 effectively, we're essentially shunting it down the histamine 1 pathway. Well, why is that a problem? Well, it turns out that histamine 1, what's an agonist, is something that stimulates that particular chemical reaction. Histamine 1 agonists are the things that tend to cause a lot of allergic reactions. We get bronchoconstriction, constriction in the lungs, as well as vasoconstriction, constriction of the blood vessels. Things that stimulate histamine 2 are going to help the neurotransmitters in the brain be relayed more effectively. It's going to be a major transmitter in the hypothalamus. Think about the hypothalamus and its connection to the pituitary. It has a regulating effect over adrenal function, over thyroid function, etc. It's a heat stress regulator. Okay, why do so many people with MS have a problem with heat? It's because often their histamine 2 is dysfunctional. Histamine 2 dilates arteries. It helps to activate the pineal gland. It's involved in something called cyclic AMP production, which is critically important for maintaining myelin in the brain, maintains the blood-brain barrier. So, according to Elaine Delac and her research, we're going to hit on a couple key points here. Well, what is it about the pineal gland in MS, and why is that a problem? Because it's actually been found in research that the pineal gland tends to be atrophied in MS patients, and that MS patients have low levels of melatonin. Low levels of melatonin is going to lead to a problem with respects to sleep. So we know that histamine 2 will stimulate the pineal gland with a wide variety of chemicals. Not only melatonin to help with sleep, and by the way, melatonin not only helps with sleep, but melatonin is a very important antioxidant in the brain. It helps to maintain glutathione levels. Glutathione is a critical chemical that helps to protect ourselves against toxicity, often depleted in anybody with chronic illness. Serotonin, we know, is critically important for mood, fine gross motor skills, etc. And then cyclic AMP. Bottom line about cyclic AMP is it's a regulatory chemical within the cells, and one of the things that it does is that it helps maintain the blood-brain barrier as well as helps to maintain the functionality or the production of myelin. Okay, so if we have a dysfunction in pineal gland output of melatonin, we're going to have a problem in sleep. If you have a problem in sleep, you're going to be incredibly fatigued. Okay. Again, another concept is that the myelin-producing cells in the brain are dying as well as in the spinal cord, and that we're seeing macrophages at the site of lesions. So the big question is, when we know that lesions occur, and that we often will find these macrophages, these cells that clean up that debris around the site of these lesions. But are the macrophages there because they're the problem, or are the macrophages there because they're coming in to clean up a problem? So everyone assumes that because the macrophages are there, that they're the things causing the problem. But perhaps those macrophages, those immune chemicals, are there because they're actually there to clean up the debris. So what's causing the problem in the cell if the macrophages are not causing it? Perhaps because these cells are dysfunctional because of regulatory factors from an immune system standpoint with respect to histamine, things that may be causing the damage, whether it's infection, whether it's cortisol, inflammatory issues, etc. Okay, fatigue. We know that fatigue is a huge issue, major disability factor with respect to MS. And we know that overwhelming fatigue is one of the things that just leads to not only physical decline, but cognitive and mental decline as well. Much of the energy in our body is produced through what's called the mitochondria. The mitochondria are these little energy factories in our cells. They churn out a chemical called ATP, which essentially is our energy currency. And the mitochondria are vulnerable to toxicity. We know that heavy metals and chemicals and other immune factors, anything that can drive inflammation, can damage our ATP. Also within our cells is something called the Kreb cycle. The Kreb cycle, again, is this energy wheel, if you will, that is heavily dependent upon the nutrition that we get through our diet, as well as it's dependent upon the regulatory factors that keep our metabolism healthy. One of the reasons I do the organic acid test from Great Plains Laboratory is a great job at assessing Krebs cycle function to see if there's any type of problem. Because we know that also people with chronic infections, yeast, bacteria, etc., those toxins can also damage the Krebs cycle too, affecting energy metabolism. So this is why we need to take a look. This is why we need to do functional testing to see what's going on at that core level. Now, there are various supplements that are helpful for overall mitochondrial function. L-carnitine, CoQ10, NADH, malic acid, these are all things that help support mitochondrial activity, mitochondrial function to support energy production. But I don't want to give the impression that you can go out and just buy supplements and then everything is going to get well. Supplements are critically important to any type of integrative medical approach, but you also need to realize that they need to be taken in conjunction with a healthy diet and trying overall to improve your lifestyle factors with respects to proper sleep, proper exercise, etc. So they can definitely help, but often just taking them alone without really working on diet and decreasing other factors that may be driving problems is not going to give you the benefit. So, but this particular group of supplements here is what we call a mitochondrial cocktail. This is a very common grouping of nutrients that are very specific for mitochondrial function. Furthering this aspect with respects to this theory, Prokarin, or the Prokarin theory with respects to MS, is that we know that heat usually worsens the symptoms of MS, and that the brain barrier, the blood-brain barrier, is often damaged. Well, it turns out that heat increases the body's production of histamine 2, and that histamine 2 increases the water content in the brain, which then cools the brain and nervous system. What's going to happen if you can't produce enough histamine 2 and you're exposed to heat? The brain and nervous system essentially heat up, and that leads to debilitating symptomatology as far as neurological output, fatigue, etc. Histamine 2 also, remember, causes vasodilation of blood vessels. Well, if we don't have enough histamine 2, we have a deficiency, we can start to run into problems of small arteries becoming constricted. And these arterioles and whatnot that run throughout the body are supplying all different kinds of important structures. The eyes, for example, the brain, the nervous system. So if we start to run into a problem of having poor blood flow, we're not only not supplying adequate oxygen to those areas of the brain, but anytime you start to run a deficit in oxygen in various body tissue, what's called hypoxia, that too can be a trigger for inflammation. So one of the factors that's involved in creating proper histamine 2 metabolism is through an enzyme system called monoamine oxidase-A, MAO-A. MAO-A is a mitochondrial enzyme in the brain and the liver. It helps to metabolize serotonin, something called norepinephrine, as well as histamine into their active metabolites. This is key. It converts them into their active form. So we actually have a form that essentially is in storage that is, it needs to be converted into its active state to have its physiological effect. And monoamine oxidase-A is in part responsible for that. Now this is a particular slide that's looking specifically at monoamine oxidase-A activity for serotonin production, okay? And we can see here where we have this thing called 5-HT. This is our serotonin being stored in its vesicles. It's then released. The serotonin is then being acted upon by the monoamine oxidase-A, converting it into these blue oval-shaped figures, which is its active form, and then this active form complexes with that postsynaptic neuron. Physiological effect, we're left over with a byproduct. The same type of thing is happening with histamine. So what are some things that can actually cause a decrease in monoamine oxidase-A activity? Well, certainly genetics can play a role. high estrogen levels can be an issue. And the reason this is important is because our environment, particularly with respect to phytoestrogens, which are plant-derived estrogens, as well as plastics and chemicals, are having an estrogenic effect in many people's bodies. So we're adding to that overall pool of estrogen-like substances, not only for females, but for males. We know that heavy metal toxicity can be an issue. Stress, as I mentioned before, what's called lipid peroxidation, that's just oxidative stress of the fats in the body, can all lead to a diminishment of monoamine oxidase-A activity. And so one of the theories with respect to MS, and I think it's a very plausible one, is that a deficiency of monoamine oxidase-A activity, and in turn a deficiency of histamine 2 production, can lead to the vast majority of these things that we see in MS that I've already discussed, and I will discuss further in subsequent webinars. So we know that this system is important for helping the cell to produce the energy currency of ATP. It's important with respect not only to histamine, but for serotonin and norepinephrine, which has an effect on mood, wellness, attention, memory, and that this system overall helps protect us against the ill effects of aging as well. So what is some things that we can do about it? Well, if we look back through this presentation, we realize that we can work on diet, we can work on gut function, we can work at reducing toxic foods, we can work at improving adrenal function, we can work on, just decreasing the toxic load of things that we're exposed to. And again, I will be discussing this further through subsequent webinars. Prokarin is a therapy that Elaine Delac developed many years ago, and many people with MS have received great benefit from it. Essentially, it's a proprietary blend of a histamine 2 agonist called histamine diphosphate and something called a phosphodiesterase inhibitor, which is caffeine citrate. Now, histamine diphosphate has been used for years in medicine, going way back, not only in MS treatment, but for other neurological disorders as well, and Meniere's syndrome, which is an inner ear problem. Caffeine citrate is actually a nervous system stimulant. And what it does is it helps to, it prevents the activation of this phosphodiesterase inhibitor. And why that's important is because in inhibiting it, it'll actually enhance the production of cyclic AMP. And remember, what is cyclic AMP? It's one of the things that's produced by the pineal gland, and it's critical in the cells as a regulatory factor over brain function and nervous system and energy production. But again, cyclic AMP is also involved in maintaining the blood-brain barrier and helping maintain the adequate production, if you will, of myelin, and myelin being that nerve coating around our nerve cells that is often damaged, or I shouldn't say often, is damaged in MS. To learn more about Prokarin, I encourage all of you to visit this website here. You can actually just type in Prokarin in Google or whatever web engine you use, and you can go directly to the website here, www.edmsllc.com. This website also has, Elaine's story with respect to her development of Prokarin and her own dealings with MS. Prokarin is actually delivered through a transdermal application. Many of the improvements I've seen with patients with Prokarin is improvements in energy, strength, decreased muscular stamina, decreased muscular spasms, increased stamina, less heat intolerance, improved cognitive function, attention, just an overall improvement. I don't want to make it sound as though Prokarin is the magic bullet, but it is a significant treatment for many people with multiple sclerosis, and I certainly believe, and from what I've seen in my own clinical experience, a worthwhile therapy to pursue, and in conjunction with healthy lifestyle, diet, etc. So with that, I appreciate all of you joining me this evening. Again, if you have further questions with respect to Complementary medical intervention for MS. If you would like to dialogue with me through the internet, you can reach me on a daily basis through askthedoctor-ms.com. This is the subscription site. There's no long-term contracts. You can join for a month or however long, and you can access me there through the member forum. And I'll be happy to help you in any way that I can, as well as if you want to get more information about me personally, you can access information here at www.drwoeller.com. Thank you.